Hello friends, welcome back in the channel of Clinical Care Insight. We started a series of lecture on the sterilization and disinfection. Until now, in first lecture, we had a detailed discussion over the sterilization. What is sterilization? What are the methods of sterilization? In that, we seen the sterilization by the heat. Okay, and in the heat, we've seen the different, you can say, method. Then we studied about the another types of sterilization called as the eradication. This eradication is done through the use of radiation. Very good, both the ionizing and non-ionizing radiation. We also seen that the one of the you can say another method of sterilization is called as the filtration, and we also seen that sterilization generally you can say encompasses the physical method. But there are certain chemicals which provide the total microbial free ambience. Understood? And that chemical name, do you remember? Yeah, it's a formaldehyde and glutamate. For formaldehyde and glutamate, these are the two chemicals, and also called as the ethium oxide. Okay? No problem. Now, in today's lecture, we are going to discuss about the second part of this lecture called as the disinfection. What is the mean by disinfection? So here is today's lecture outline. First, we will deal with the introduction. Then we will discuss about what is the meaning of disinfection. Okay. Then we will also see about the decontamination, how the disinfectant and this you can say contaminations are used interchangeably. Then there's a kinetics of cell death. As I said previously, that whenever you use any of these two techniques, either sterilization or disinfection, you cannot achieve total microbial free ambience instantly. It needs time. It takes some time. Okay, in a one given proper time period, you can encounter not all the microbes. Okay, so it follows the pattern. It follows the pattern that we are going to study under the kinetics of cell death. Then we will discuss about the central sterile service department in the hospital setting. So make the heading first: disinfection. Disinfection. Now, and the word disinfection, it means to minimizing the microbes in such a level where they are no more pathogenic. Remember, in the sterilizations, we are achieving a total microbial free ambience or total sterile environment. But in the case of disinfections, we only encounter, or you can say we only suppress the number of microbes. Okay, we made, you can say the things, or we can say we make the microbial population in such a low, you can say, count that they are no more pathogenic. They are no more pathogenic. It is called as the disinfection. Okay, so you should write it down. About the aim of the disinfection is to reduce the number of pathogenic microorganisms. Write it down. Reduce the number of pathogenic microorganisms in such a way that they are no more, you can say, they are no more capable to harm. Got the points? The fundamental difference between the sterilization and disinfection is that here we are, you can say, encountering, or we are generally reducing the number in there, you can say, that level where they are no more harmful. But in the case of sterilization, it is a total encounters of the microorganism. Now, this disinfection word, it is generally interchangeably used for the another word that is called as the decontamination. Decontamination. Remember, whenever a sterile product, whenever a sterile material, okay, is used by the either by the infected or non-infected person, okay, for that second use, we have to decontaminate, because whenever, suppose this is one scalp spine. Now it is used for patient 1. It is used for patient 1. Initially it is a sterile, okay, initially this scalp is sterile, but when it is used for the first patient, okay, fine, it is a seizure basically, okay. Now it is more unstable, okay. Suppose it is a seizure, okay, and it is used for patient 1. So before using, it is kept sterile. It is kept what? Sterile. Now, once it is used for patient 1, it become now non-sterile. It become now it become now contaminated. What it become? It become now contaminated. So for using this same scissor to the next patient, we have to decontaminate it, okay. And for that decontamination, okay, we are using sometimes we are using the sterilization techniques by the heating, okay, or also called as by the autoclaving method, okay. And sometimes we generally first decontaminate those, you can say, used medical equipments, okay, medical equipments. So decontamination is what? It is basically, you can say, making contamination free. Got the points? Making contamination free. It means the decontamination. So just see, here also you are not achieving the total, you can say, microbial free environment, total sterile environment. So that's why this disinfection, okay, and decontamination, it are used interchangeably. It are used interchangeably. Fine, got the points? No problem. Now, in the case of this both, we are using certain chemicals. And those chemicals, okay, those products, they are basically referred as a disinfectant. That are referred as a disinfectant. Fine, no problem. Now, this disinfectant, they are, you can say, most of the disinfectants are in the liquid form, or you can say semi-solid form, or they are in a jelly form. And this disinfectant, whenever we applied, or you can say whenever we use, okay, it causes the microbes, okay, in their minimal level, okay, or you can also call as that their non-harmful number. Got the point? And most of the usable, you can say, disinfectant, okay, most of these chemical agents, they are alcohol. Okay, you should write it down. These are important. First one is alcohol. Now, this alcohol, their concentration matters. Generally 40 to 60%. How much? 40 to 60% alcohol concentrations act as a disinfectant. Okay, and most of the two notable alcohol derivatives are ethanol and propanol. You should write it down. the example of alcohol based disinfectant is the ethanol. Okay, one is called as the ethanol. Okay, another one is called as isopropanol. Okay, what these chemicals are doing, they are the alcohol, you can say alcohol derivatives. They bind with the enveloped portion of bacteria as well as the virus. You know that the bacteria possesses the cell wall. So basically, the molecules of alcohol, it bind with the cell wall, it bind with the cell wall and make the cell wall porous. Now what happened? Due to this porous cell wall, okay, the outside liquids, they come here, the outside water come here, and cell become full of the water, and there is eventually the cell lysis, means cell death. Lysis. So this is the mechanism of action. Okay, this is the mechanism of action of alcohol disinfectant. Fine, what is doing? Repeat once again. These alcohol molecules, they bind of the cell wall. Okay, in the case of bacteria, they bind with the cell wall, and in the case of virus, these alcohol molecules, it bind with their enveloped. Okay, they are enveloped. So mostly the enveloped virus, okay, it is you can say susceptible to alcohol based disinfectant. The another category of this disinfectant is the is based on the halogens. You know that in the halogens there are different elements come. The one of is the chlorine. Okay, chlorine, iodine, and iodines are basically used. So what are the things called as the chlorine, and iodine? Okay, and the another category of the disinfectant, okay, is the phenols. So phenols are also widely used. Phenols, they are also widely used as a disinfectant, and if you write down the examples, then Dettol, okay, Lysosol, as well as the chlorhexidine. These all are the phenol derivatives. So just to recap what we studied that apart from the sterilization, which is basically a technique where we are achieving the total microbial-free ambience, there are another techniques, okay, and by which we are reducing the number of microorganisms. We are making microorganism number in such a way that they are no longer harmful. Fine. So this process is called as the disinfection. Fine. Then another word that is called as the decontamination. Decontamination is basically making the contaminated object, okay, making the you can say contaminated object again free from those you can say contamination. That is called as the decontamination, because it's also involve not the 100%, or you can say not the total microbial clearance, total microbial encounter. So this decontamination as well as this infections, okay, these words are used interchangeably. Now this both the techniques, okay, is done through certain chemicals, and these chemicals are basically, the prime one is the alcohol, okay, and these chemicals are called as the disinfectants. So first one is the alcohol. Now remember, the 40 to 60% of concentration of alcohol is sufficient to act as a disinfectant. So one of the notable example is ethanol, and another one is the isopropanol. Now what is their mechanism of action? Their mechanism of action is that they will bind, okay, with the cell wall of the bacteria and make cell walls porous, okay, and eventually you can say the extracellular fluid, they come inside, okay, and cell will, you can say, swell up, and there is a cell lysis, cell death. That's the mechanism of action. Now, in the case of viruses, they will bind over the envelopes. They will bind over the envelope and make viral DNA exposed. Okay, make viral DNA exposed. Now, another disinfectant is the halogen family. And halogen family, you know that chlorine and iodine. Okay, it's both act as a disinfectant. Now, in the case of phenol, there are two derivatives called as the detol and lysosol, also chlorhexidine. These are the some of the, you can say, commonly used disinfectant. Fine, commonly used disinfectant. No problem. And also there are certain things called as the surfactant. Surface acting substances is called as the surfactant. So you should write it down. Surfactant. Surfactant means, yeah, surface acting agent. Surface acting agent. Now this surface acting agent, your soap as well as soap and detergent, they both comes under the category of surfactant. Okay, under the category of surfactant. So once we discuss about the introduction, disinfectant, decontamination, okay, disinfectant, now let's go and discuss about the kinetics of cell death.